Skin surgery covers a large list of procedures. They can be very simple, such as a small skin biopsy, up to more complex procedures which we need to do flap reconstruction or a skin grafting to cover the gap after removing the lesion, which is mainly a skin cancer or in some cases benign lesions like a normal mole. What we need to know about a skin surgery is classified into three main areas: before the procedure, during the procedure, and after the procedure. Before procedure, especially if your pain threshold is low, you need to be prepared. I suggest you can take paracetamol or your routine painkiller before coming for the surgery. Certain patients on long-term pain management might not need to take any further action. I wouldn't recommend taking medications making you more drowsy, such as oxazepam or any other medicine from benzodiazepine group. Also, infection is another important factor to consider. In some area, such as a scalp or private part of the body, the surgeon might not be able to cover the area after the procedure. And also because of the location of the skin, those areas are potentially at a higher risk of infection. That needs preparation before coming for surgery. We have certain germs which might grow on the skin, especially on the skin folds, such as on the armpit, groin area, and also inside your nose. Under normal condition, they might not cause any problem. However, if you have a cut on your skin, or for some reason you have some problem with your immune system, they might become a big problem and get to your blood and also cause infection inside your body. During surgery, because of the cut and interruption in the barrier functioning of your skin, those germs might get into the skin and cause infection. And consequently, it can increase the risk of delayed healing and disfiguring scarring formation. What we recommend in such circumstances is to try an antiseptic wash such as Dermal 500 lotion all over the body, and to make sure it's including the skin behind your ears, around your nostrils, around your neck, your scalp, underneath the breast area, armpit area, skin flexures, groin area, between fingers and toes, and underneath your nails. And to rinse it after 5 to 10 minutes. This is the recommendation I make to my patients to do on the same day they coming to see us for the procedure. What you need to know about during the procedure. The majority of the procedures we do under local anesthetic, which means we mark the area and then we inject different types of local anesthetic underneath the skin, which works very quickly, within up to a minute, and then we start doing the procedure. The rest of the procedure should be totally pain-free. However, some people, especially children, might not do well with the burning sensation of the injection of local anesthetic. What we can do in such cases is to apply a numbing cream on the skin area we're going to operate on an hour before the procedure. What we use is called Receptura, which is quite stronger than many other numbing creams currently available in the market. Make sure you mention your issue about the pain from local anesthetic when you're coming to see your doctor, or discuss it with the admin team. Also, the other modalities we use during the procedure, especially for children, to reduce the pain is using target cool gun, which is cooling down the skin and make the skin less sensitive to injection. We do the procedure, and then the majority of the cases, if there is a cut within the whole thickness of the skin, we need to close it by suturing the skin. We use 2 different sutures. Majority of cases, the sutures we use include non-absorbent one on the top and the dissolvable one underneath to take the pressure and tension from the edge of the surgical wound and help with healing. Sutures, we use non-dissolvable sutures on the top layer of the skin, because dissolvable sutures might stay longer on the skin and increase the risk of infection and leaving a mark on the skin, which might not be cosmetically acceptable to many of our patients. What happened after surgery? After surgery, the local anesthetic usually stops working within 2 hours, and that's the time you need to prepare yourself to control the pain. Especially if your pain threshold is low, I highly recommend you start taking appropriate painkiller before it starts. Usually paracetamol 500 milligram tablet, 2 tablets 4 times a day would be an appropriate option to try. In case it's not sufficiently controlling the pain, you can try the combination of paracetamol and codeine in form of cocodamol on a regular basis. Other painkillers, including non-steroidal anti-inflammatory medicine such as ibuprofen, would not be an appropriate option, and at least not a priority, because of increasing the risk of bleeding. Infection is more likely to happen in patients with underlying conditions such as type 2 diabetes, or those patients on immunosuppressive medication. Also on certain area of the body, such as private area, procedure on skin, folds, and lower legs, the risk of infection is much higher than the other part of the body. Scarring is more likely to be hypertrophic or keloid on certain age group or certain part of the body. If we cover your wound after the procedure, it doesn't usually need to stay long. Most of the time, we advise our patients to remove the dressing after 2 to 3 days. And during the period of time the wound is covered, you need to keep the area clean and dry. In certain cases with increased risk of infection and bleeding, such as procedure on nails, the dressing might need to stay for longer. Other cases need longer duration for dressing. Is those cases we do a skin graft or sometimes flap reconstruction. You can usually remove the dressing by yourself with no issue. Sometimes it's better to moist it with a little bit of lukewarm water and then remove the dressing very gently. After day 2 or 3, when you remove the dressing, avoid application of another dressing like plaster on the area, unless you are exposed to dusty, dirty environment or the wound is uncomfortable by constantly catching your clothing. Even on those cases, don't keep the area under long-term dressing. Long-term dressing would make a warm, moist area, which is great opportunity for infection to grow. In certain cases, when we do skin graft or flap reconstruction, we might need to see you and remove the dressing in our clinic, in which case we will advise you when you're coming for the procedure. In those patients at a higher risk for infection and also increased chance of developing hypertrophic or keloid scar, we recommend to do photodynamic therapy after the procedure. The standard protocol we use in our clinic is having the first session soon after the procedure and the second session of photodynamic therapy when they're coming for wound review and removing the sutures, which is usually within 7 to 14 days. We don't usually touch a very big blood vessels during the procedure. However, if the procedure is involving the skin on face, if the patients are on blood thinning medication or steroid tablet, or especially in elderly population, there is a higher risk of bleeding. That's very important to inform your surgeon if you are taking any medication increasing the risk of bleeding. Occasionally, it might be risky if you stop taking the medicine and you need to take further advice from your GP or the physician who started you on those medicines. After the procedure, to reduce the risk of bleeding, especially if you are at high risk, we apply pressure dressing. Also, when you go home and notice bleeding or oozing underneath your dressing, it's better not to be panic about. Most cases, the only thing you need is to cover the existing dressing with another one and apply a gentle pressure on the area for 10 to 20 minutes. The other strategies you can use to reduce the risk of bleeding is including avoiding ginger, garlic, alcohol in your diet. Make sure keep the surgery site at a higher level compared to your heart level. Don't lie on the surgery site. After surgery, especially if it involves suturing the skin, you might not be able to go back to your normal activities for a few weeks, which is including regular exercise and swimming. Once you remove the dressing a few days after the procedure, you need to monitor the area for any sign of infection, which is including very severe redness and swelling, increasing the pain compared to amount of the pain and discomfort you had on day 1, discharge from the area, or any other unusual features. On that case, you need to contact your physician or the nurse to review the wound. My routine is to ask my patient to send us the photo of the wound if they have any concern, and we will advise them. The majority of cases, infection, if exists, is very mild and can be treated with antibacterial cream in the presence of normal immune system function. Once the sutures are out, 2 to 3 weeks after the procedure, that's the time you need to keep an eye on the area in case the area getting raised and lumpy or itchy. That could be early sign of keloid or hypertrophic scar formation. And at this stage, it's very crucial to take an immediate action before it's too late. Otherwise, the response to treatment might not be as well as if we started early, and it might not be as gentle as early treatment. For example, at a very early stage, we might be able to control it with application of silicone tape, a steroid tape, or sometimes lower concentration of steroid injection. But once the keloid scar is established, we might need to remove a big chunk of the skin, followed by the need for regular injection of steroid or other treatment options for years.